It's the diagnosis no one wants to hear: cancer. Cancer of female genital organs, particularly ovarian cancer, has a devastating reputation. Dr. Scott Eisenkop is a gynecologic oncologist in Southern California, and he answers some of the most pressing questions women have about the disease and the treatments for it.
Absolutely. Some around for a long time, some newer. Unknown to many, we have a specialty, gynecologic oncology, which determines treatment strategy, does surgery, and gives chemotherapy for all female genital malignancies, cancers. In the past, this was done by a gynecologist, a surgeon, and a medical oncologist for chemotherapy. That was viewed as a team effort. That's part of our culture and what we used to do. Problem is, too many cooks can screw up a bouillabaisse and isn't a good idea. It's proven gynecologic oncologists produce better outcomes. The only prevention for cervical cancer is an HPV vaccine that's new. Talk to your pediatrician for your child, or talk to your GYN. In terms of preventing, pap smears have been around for a long time. Please get one regularly, because it can find a precancerous condition that's treatable. In terms of ovarian cancer and uterine cancer, there is no screening. But what we can do is find a genetic disorder that is manageable in a special way. Treatment actually depends on how advanced the disease is, but most people can be treated with minimally invasive surgery. Laparoscopy around for years and improving constantly, or the newer robotic surgery, which offers unique handling of tissue. Both allow rapid recovery and starting chemotherapy or radiation rapidly if needed.
Felt very confident that I'd heard a lot about Dr. Eisenkop and knew that I was in great hands, so I have felt very good. I've literally been in no pain since the day I was diagnosed till today.
Symptoms tend to be delayed late in the disease, so people tend to have bloating, they get full early, tend to urinate frequently or discomfort with urination, and those are non-specific symptoms. They're like a lot of other diseases, so the diagnosis is delayed. If you have these symptoms for more than 2 weeks, insist on seeing a gynecologist, please, and get an ultrasound. Because there's frequently a delay in diagnosis, we often have advanced disease, and the key to treatment is surgery by a gynecologic oncologist experienced with all treatment options of surgery to remove as much disease as possible, ideally all disease, before treating with chemotherapy, because chemotherapy is most effective if virtually all disease is removed.
My diagnosis was ovarian cancer stage 3C, and I have always had the highest regard for Dr. Eisenkop. He's respectful, he's right on top of all the medical procedures and the chemo. He knows exactly what needs to be done. He's aggressive. I like that because I'm aggressive. I'm doing well. It'll be 3 years since the last surgery, and there's no evidence of disease.
I'm doing great. It's 20 years. And I have gone back to my profession, other than the fact that now it's 20 years, so I've just retired. But I was able to get back to my profession, which is being a college professor. And I teach art, and so I have my artwork to keep me occupied nicely. But Dr. Eisenkop is a wonderful doctor.
It's proven gynecologic oncologists produce better outcomes. Don't assume that you have to go to the most prestigious cancer center. Some of the best results are in community hospitals. There are lots available throughout the United States in community hospitals and tertiary care centers. Please see my website.
For more information or to make an appointment with Dr. Eisenkop, call today or visit womenscancercenter.net.